Okay, Dr. Huebner here with Natural Transplants. We're here with our VIP patient of the day, Cheryl. And Cheryl is here for our standard HUE procedure, the HUE procedure, to address her areas of alopecia. And Cheryl, thanks for coming in today, and we want to get your ideas about what brought you to get a hair transplant with us. So just tell the people out there who may be in a similar situation to you kind of how your story began, and when did you start noticing your hair loss?
Well, I started noticing my edges probably at a maybe younger age were thinning out.
Sure.
And then I got a facial procedure done, and it kind of made the area a little more visible. And so I wanted to, I didn't feel comfortable, not wearing my hair out because of that.
Sure.
And then I also started noticing a little bit in the frontal area here, but I really didn't know until later that was due to a genetic problem, and so
sure,
it surprised me.
And we'll talk about that in a second. How has it affected you in your daily life, your hair thinning?
It kind of limited me to what I could do with my hair. I felt myself always wanting to wear or needing to wear bands, and I really didn't want to limit myself to just wearing bands.
Sure.
or wigs. I know wigs are a thing of today, but I'm more of a natural person.
Sure.
And I like to wear my hair.
Sure. So we're going to put your natural hair that's in the back of your head naturally where it used to be, and you still have some there. It's it's just a little more fine than it used to be. So we're just basically going to recreate your old edges and give you your hair back in those areas.
Yes.
With the understanding that the density is limited in one procedure, and it may take a second one to ultimately get where you eventually need to be. But some people are really happy with just the one. So the other thing I wanted to ask you, Cheryl, is how did you find out about our clinic?
I was doing some research online, and I found a video that was done by your brother.
My brother Matt, yeah.
Matt in Florida, and I was really impressed with the video, and the person that was getting her hair done, her name was Tanya.
Tanya, yes.
Yeah, and so I was really impressed about that video, and so I called their office and I asked them, was there a location in my area in Maryland, and they said. And then about a month later, I got an email in my email stating that they had just opened a new clinic in my area.
We said Cheryl wants an office there, so we're going to make one.
I was very, very
But no,
surprised.
yep, and we're really happy to serve people in this area that don't maybe want to travel too far and still want to get a world-class hair transplant. So very happy to hear that. So the last thing I want to say is Cheryl did all the right things in leading up to getting this procedure today. You always want to make sure that you're an appropriate candidate for a transplant. So you want to see a dermatologist and have them examine you, and you want to rule out what are called scarring alopecias. And scarring alopecias can sometimes mimic the same exact pattern of alopecia that we're seeing here in Cheryl, and it's not suitable for transplant. So Cheryl went and got a biopsy, and we got some blood tests, and they all came back fine. And the biopsy actually showed a more of a genetic pattern than we thought would be the case, given that she had her hair in twists for a couple years, and we thought this was more of a traction pattern. But then she just told me that her sister also had some baldness, so it runs in the family. So we're dealing with a little bit of genetics and maybe a little bit of traction too, because it's not always just one story. So let's just pan around here. We'll show people what we're going to be doing today, where are the areas we're going to be working in, and we're really looking forward to going through this journey with you today, Cheryl. And we'll check in with you in a couple minutes. Okay?
Okay.
Thanks so much.
Thank you.
Okay, Dr. Huebner back here with Cheryl, and at this point in the day, we've discussed what Cheryl's goals are, and we've drawn out a new hairline for Cheryl. Now, we didn't have to chase her old hairline. We put a nice feminine rounded hairline on, which you can see, nice rounded contours coming down into the temples, not too far down. But we didn't have to chase, and what I mean is we didn't have to chase so far back up into here where her old fuzzies were. So we're going to recreate all the way behind that. So right in the front there, same thing on the other side. And we've done the traumatic part of buzzing away the hair, and Cheryl hasn't hit me yet, so I think we're going good. So Cheryl, how excited are you to get in there, and what would you say so far to this point?
It's worth it. I mean,
It's worth it, and we haven't even done anything. You can already tell, looking at the new line, where your hair is going to be, how exciting that's going to be for you when you get your old edges back. So
I can't wait.
Can't wait. Me neither. So we'll check back with you in a few minutes, and looking forward to your progress.
Thank you.
Okay, Dr. Huebner back with Cheryl, who has just completed her procedure, her HUE procedure, in under 6 hours. And Cheryl was an all-star patient. She basically said she had no pain throughout the entire thing, but I'll let her tell you. Cheryl, how was your procedure day? What were you doing? Were you in any discomfort?
No.
Just overall, how was it?
No discomfort at all. Basically, I just sat and just let them do the work.
Yep. And even the anesthesia for you didn't seem to be too much. Some people have a little harder time, but she got through that really, really easily and never experienced a twinge of pain for the rest of the day, which is awesome.
No pain.
No pain. And we constantly were asking you, you're comfortable, to the point where it's annoying.
Yes. They were very accommodating, very.
Excellent, excellent. So let me pan around and I'll show you what we've done for her.
Don't let me scare you.
But you can see all these bumps, all these little bumps are going to be multiple hairs that will grow for Cheryl. And you can see, look at this area we were able to cover. All the way down there on the sides, nice round hairline. It's still staggered. Again, all the way down to this side, same thing here. Now she looks a little goofy just because we dressed her up to get home, so she's not gonna be, pulling any of these grafts out when she gets home. But for the next couple days, she's just gonna be taking it easy, keeping her blood pressure down, not doing any heavy lifting or anything like that. Maybe dancing to some R&B music. We listened to some Boyz II Men today. That was a lot of fun. So Cheryl, I guess the last thing I want to ask you is if anyone out there is kind of on the fence and thinking about doing something like this, but maybe has reservations about the procedure itself, what advice would you give them given your experience today?
I would say that I felt no pain. I was very comfortable throughout the whole procedure. And so I'm just waiting for the final results.
And you know what? And T0 starts right now, right? So we're gonna wait. It's gonna take a few months to really start growing in.
Yes.
But I think in a few months, 8 or 9 month mark, you're gonna be super, super pleased about what's happening, and hopefully be able to wear your hair in hairstyles that you haven't been able to in a while. So
I'm very anxious.
That'd be great. And we're gonna give you a call tomorrow, check up on you, see how your night went, make sure everything's going okay, make sure you don't need anything else. And we look forward to following up with your progress, Cheryl. Thanks so much for sharing your story with everyone, and we'll check in with you soon.
Okay, great. Thank you.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.